Hello, I'm Dr. McMullen. I'm a psychiatrist that's been in practice for over 3 decades, and I've mainly specialized in treating depressions and other psychiatric illnesses with medication. And then about 6 years ago, I added another modality called TMS, transcranial magnetic stimulation. Now, people have been asking how effective is antidepressant treatment and what the options are. Antidepressants work extremely well. However, they don't necessarily work suddenly, and they don't work 100%. There was a famous trial called the STAR-D trial, and in that trial, 31% of patients became euthymic. That means their depression completely remitted in 14 weeks. And then after 6 months, 65% were in complete remission. However, there's a lot of other factors here. One is that that means 1/3 of patients were not in complete remission after 6 months, despite aggressive medication care. And also, many of those patients might have been going to be back to normal in 6 months anyway, because in many people, these depressions happen, and they're set off often by some bad event, and they last 6 months, 9 months, a year, and then they remit on their own. So looking at statistics, it doesn't answer the question so well about us individuals. However, with an antidepressant, you have about a 15% chance you'll be all the way back to normal in 6 weeks. Now, this is going to be particularly true if you have not been chronically depressed all your life, and if you've had long periods of feeling normal and then you get intermittent depressions. And then as the weeks and months go by, you have a higher percentage of people that are going to come all the way to normal, and you'll have an even better chance if you add things that help depression. Like there's certain nutrients like fish oil, and in women particularly folic acid sometimes helps. There's a number of things that one can add, and sometimes other antidepressants that we call them augmentation strategies. Now, once one has failed on one antidepressant, the likelihood that the next antidepressant is going to bring them all the way to normal gets lower and lower. So if you've tried 3 or 4 antidepressants, the chances that the next antidepressant is going to bring you almost to normal is almost zero. For example, you might use the strongest antidepressants available, which are the MAO inhibitors, and you might do better than you've done with the other antidepressants, but it's unlikely to make you 100% if you've been going for months and years not responding to medicines. With TMS, the statistics are actually somewhat better. That with 30 treatments of transcranial magnetic stimulation, that means 30 days, usually 5 days a week for 6 weeks, about a half an hour treatment, about 1/3 of people are going to be in remission in 6 weeks. They're going to be completely back to normal. And that is actually rather good, because most of these people are people that have failed on a few medicines, because people rarely come to TMS for their first treatment. They usually come after they've exhausted their energy trying out different antidepressants that haven't worked. So to have a 30% of people come all the way to normal is pretty astonishing compared to less than 5% if you tried new medicines. Now, the chances of it working really well are a little higher if you've been one of these people who have depressions occasionally and then you will come all the way back to normal, and they've come and go. It's a little harder, and it takes a little longer to get people all the way to normal if they've been depressed all their life, and no matter what medicine they've taken, they've never quite been up to normal. Those people are actually the ones that really should have TMS, because they really have a chance that it'll change things. Now you have to think about these illnesses as chronic, because almost all the illnesses except pneumonia and infections that we suffer from are chronic. If it's arthritis, if it's heart disease, if it's diabetes, and this includes depression. It's not something that you can just take a pill or take TMS and get completely better and then stop the medicine and expect to be cured the rest of your life. And it's very hard to do that. If someone wants to treat themselves for depression, that's a big task. You might be able to do it if you take a number of the nutrients that have been shown to help depression, like fish oil and NAC and so on, and also exercise a lot, really vigorous exercise for an hour or two a day, and also put a lot of energy into improving yourself and improving your career and your social contacts and your knowledge base and your interest. And if you do all these things, it certainly would help your depression. But it's hard to do all these things, or we would have done them. And sometimes, even when everything turns out perfect, it doesn't get rid of the depression completely. I had a lady once, this was 30 years ago, and she was about 65, and she had been depressed all her life, and she had lost 2 husbands, and the first one she really loved, but even in that marriage she probably wasn't all the way up to normal in mood. And so here she was, a single woman, and she was Orthodox Jewish and living in a community where everybody was families, and she was a single woman working at minimum wage filing. And she had 2 nice children, but they lived in a different city. So she was chronically depressed, and I put her on fluoxetine, Prozac. This was back when Prozac just came out, around 1988. And she did terrific. She came all the way to normal. It was really astonishing. She became a bubbly, warm, self-confident person. And then she started dating people. People would set her up with men to possibly marry, and they would send these men that were a little too old and so on, so she wasn't too enthused. And then something very remarkable happened. She was introduced to a man who had just retired from the military. He was a rabbi, and he was a widower. His wife had died, and they were just crazy about each other. They were really in love, and he happened to be from the same city she was from originally. So she was going to get married and go back to this city, and then she'd be going to the same synagogue that she'd gone when she was little, and all the other women there would be people she'd known since elementary school. So, and she'd never have to work again. And I told her, listen, don't stop the Prozac. And then a year later, she calls me up and she said, everything turned out perfect. The marriage was great. They just were extremely comfortable with each other. And his children and her children, they're all like one family. They all accepted each other, and they come together in the holidays. And she never has to work again. All she does is cook meals and take care of the house and be active in the community. And everything that she ever wanted in life, she got. She didn't want riches. She wanted money. This is what she wanted, and she got it. And she said, I just don't understand it, Dr. McMullen. I stopped the Prozac, and after a few months, I'm depressed again. And that's and I explained to her that she's somebody that has a chronic depression. So even if she wins the jackpot, which she did, she still regressed. Now, it's hard to convince people of this. I use her as an example because very few of us hit the jackpot. So if you are chronically depressed and you did hit the jackpot and you won a lot of money and you also got promoted up to a very high position and the ideal job and you met the ideal person, romantic person, you might be surprised, just like her, that you stay chronically depressed. And it's just an illness. Now, some people, when you do hit the jackpot, it will help lift the depression and it may go away, but it doesn't always do that.
Thank you very much.
Now, another question people have is that what's the difference between TMS and medication? And the main thing is that the TMS has a higher chance of bringing you all the way to normal than using a third or a fourth medication, because you have at least a 1/3 chance. And if the patients have a fairly good prognosis, that they're younger than 75 and their depressions come and go and sometimes they're completely abnormal, then we may be getting 50% or more all the way to normal. And that's a really huge percentage. Now, another thing that happens with TMS, and Harold Sackheim said this, is that it's better than ECT shock treatment because it lasts longer. It's not only more comfortable and safer, and it's not painful, and you just go in and have this treatment that's not uncomfortable for 30 minutes, and then you get up and you go to your job or you go to school and you go about your day. It just takes up some time. And you don't relapse so readily. He said that with ECT, you frequently are going to relapse into the same big depression 6 months or a year later, and you're going to need the same 10 shock treatments again, or 12, or whatever. But with TMS, frequently people go longer. We have people that have gone 3 years, and one patient in particular who was really had a terrible problem with depression that I treated from 6 to 22. She's now gone 4.5 years without any relapse and without needing any more TMS. Now, she's on some medicine. People usually stay on some medicine, maybe the same medicine they were on before, because you need something to protect you from coming back. But the other thing is when you do relapse, you don't need to do another 30 treatments. Often it's just 4 or 5 treatments. Sometimes people, they relapse every few months, or maybe then they go for a long period and it's 9 months. But sometimes they come in and they get 1 or 2 treatments and they're back up to normal. Sometimes they need 5 or 6 or more. But it's almost never the full complement of treatments. And Harold Sackheim said that we are really giving a homeopathic dose of a magnetic field going on and off on the brain. And that this changes the activity in the brain for maybe 45 minutes after the treatment. And then everything is back to baseline and you can't see anything different. And then maybe 2 weeks later, the depression is beginning to lift. And he said he thinks what's happening is that the TMS is enabling the brain to cure itself of the depression, that the brain wants to get better and it cures itself. And that really struck me when he said that, because that would explain why people have these long remissions after it, and that when they do relapse, they don't need a great many treatments to get better again. It's like the brain has permanently changed itself in a good direction. And that's really remarkable. And that often changes the whole course of the illness. Somebody who's just struggled all their life or for many years with depression and taking antidepressants and having them partially work and then fail. And it's so often that I see people come all the way to normal and stay like that for a very long time, and you talk to them, and for the last 2 years they've been the best they've ever been in their life. And then if they relapse a little, they get a few more treatments. That is a whole revolution in psychiatry.
Thank you very much, Dr.